Welcome to A Dad's Path, where we navigate the heart and science of parenting. Each episode, we tackle issues that dads everywhere face and deliver actions you can take right away. Join us as we uncover the balancing act of raising resilient, loving kids. Visit us at adadspath.com to learn more. Ready for the journey? Let's begin.
Hello and welcome to another episode of A Dad's Path podcast. I'm Will Braunstein. Today we're here with Dr. Jill Grimes. She's a nationally recognized medical media expert, award-winning author, and proud mom of two awesome collegiate daughters. After 2 decades of private practice, Dr. Grimes now splits her time between writing, speaking, seeing patients, volunteering, and vaccinating. She is also the author of an award-winning book, which I love. It's called The Ultimate College Student Health Handbook, your guide for everything from hangovers to homesickness, which, as the name suggests, is great for college students. But as you flip through it, it's also great for us adults. And even there's a lot in there for younger kids who are not in college yet. And that's kind of where we're going to be focusing today. You can find Jill online at jillgrimesmd.com. You can get her book at your local bookstore or wherever books are sold, and Amazon, of course. And she's on TikTok at the College Doc. So Jill, welcome. So excited for this.
I'm excited to be here.
Awesome. So I want to start by, going through a couple common health ailments that seems like go around when your kids are in school. They just get sick.
Mm-hmm.
It feels like a lot.
Germ factories.
They're germ factories, and hopefully that's a good thing for them.
Yeah.
But I want to start with strep throat, like a fairly common one. Like, sometimes your kid's like, hey, my throat hurts. How do you know if that's, what are some symptoms beyond that? How do you know we should go to a doctor or not go to a doctor? What would you recommend?
Great. Yes. So strep throat is the big one on sore throats. And there's one really key element to remember. And that is that there are 4 things that we look for with strep throat. 3 of them are what you expect: fever. So temperature greater than 100.5. Sorry, I'm getting notices on here. I apologize. Let me stop and put it. I have it on focus. I'm not sure why the notifications are still coming through. So I'm sorry. 1 second. It's just not showing that it's on, even though. All right. I'm sorry. I don't know that I can fix that. Okay. I'll start my answer again. So sorry. Thank you, sound person, for editing. So yes, strep throat is really common, and it's really important to know that strep throat, the sore throat of strep throat, will disappear on its own without antibiotics, but that's not a good thing. We worry about strep throat because that particular bacteria can go on to do damage in your heart and your kidneys. So that's why it's important to find it. And the key to knowing whether or not to take your kiddo in is there's 4 things that we look for. Number 1 is a high fever, so temperature greater than 100.5, so is a true fever. The second is sore throat, red, enlarged tonsils. And I'll give you a hint. With strep, when you shine your little flashlight back in there and you look, we're looking for those 2 lumpy things on either side of the back of the throat. That's the tonsils. They tend to be sort of fire engine red with strep throat. And it often is just one side. So it doesn't have to be both sides really big. It might just be one. And there might be pus or might not. Then they have swollen, enlarged, and tender lymph nodes in the front of their neck. If they're having it in the back of their neck, swollen nodes back there, then we start worrying about mononucleosis, the kissing disease, which often you can have with strep. But anyway, for strep, fever, red pussy tonsils, with or without pus, actually, tender lymph nodes, and here's the important thing, no cough. If you have all of these symptoms, fever, sore throat, but you also have a raging cough with it, it's much more likely to be a respiratory virus than it is to be strep. But the reality is, bacteria don't read a textbook. You can have one symptom and it can still be strep. But those are the things to look for. And my general rule of thumb is if you have 2 of those things, then you ought to go in, take your kid in, and have them swabbed to check for strep.
That's great advice. And I almost feel like, as a layperson, I'm not a medical expert at all, it'd probably be good for me to look at my kids' tonsils right now when they're healthy, right? So I can see this is
Yes,
a healthy
yes,
one. And
yes. Well, exactly, because some kids have enormous tonsils, and I can tell you, if your kid snores, they probably have big tonsils. We see that a lot. And it is very helpful to know what they look like when they're not infected. So shine that flashlight in there. You may see nothing. Some people really don't have much visible tonsil or tissue. Other people have big. So it's just good to know what your baseline is.
awesome. Yeah, that's great advice. So, you mentioned respiratory viruses, and I feel like that's something that's just like, I guess, a persistent cough seems to be going around
Yeah.
everywhere, where a kid has a cough and that's kind of their only symptom. Can you talk about that and kind of in a similar way what we should look out
Yes.
for? And yeah.
Absolutely. So the cough, a post-infectious cough, so the infection's gone, but the cough's hanging on, those can last and frequently do last anywhere from 3 to 6 weeks. And that's common. It is so frustrating because you just feel like they're not getting better. They just keep coughing, especially at night. And the important thing to know is that it doesn't necessarily mean that they need more antibiotics or need any antibiotics. It just means that they've got a cough. Now, you can't fully evaluate that at home, and there's nothing wrong with taking your kid in. I'm just trying to set expectations that they may not need and probably don't need antibiotics. There's something that flared up recently, actually in Britain, that they were calling the 100-day cough, which is
Mm.
more than 6 weeks, obviously. And actually, that was specifically referring to pertussis, which is whooping cough. And that you want to think about that we can treat with antibiotics, and because it's caused by bacteria. But we think about that when someone is having intense fits of coughing, like coughing so hard that they throw up, and it just comes on and just, literally that bend over racking fits of coughing. So if they're having that, that's a clue they definitely need to go back in. But for most kids, the cough is just, and adults, the cough is going to hang on, and it should be just a slow decrescendo. As long as it's not, getting better, getting better, getting better, and suddenly worse. If it's suddenly worse, then we think about a secondary infection and definitely need to go in then. But if it's tapering, we just want to do things to help stop the cough and let them sleep. With kids, we really do not recommend any of the over-the-counter medicines anymore. We used to give them a little bit more, and we found that, one, it doesn't really help that much, and two, there may be harm. So things that you can do, you can try a teaspoon of honey. Never honey for kids under the age of 1, but I'm talking, certainly for our preteens and teens and adults, a teaspoon of honey. And that can either be straight from the spoon or in a cup of tea or however you like to have your honey. But that has been shown to be almost as effective as the over-the-counter dextromethorphan, that DM that's in all the cough and cold remedies. So you can try that. You can try menthol rubs or patches, which is like Vicks Vapor Rub, old-fashioned. And it doesn't have to be the thick gel if people don't like that. Now there's nice, neat patches that are menthol patches, and you can put those on the chest. Please do not put any of this stuff in the nose, even if you're congested. It's just the fumes that we want working. But menthol will also help suppress cough. So that's 2 things that you can do that are not even in the drugstore. They're hopefully just in your cabinet.
Yeah. No, that's very helpful. And my daughter, it feels like, coughs a lot. And is there, I know I'm not asking for specific medical advice, but in general, like, is that cause for concern that she could be hurting something by coughing? Or is that not really?
Really, the main thing we don't want to miss with kids with a frequent cough is if they're having really an asthma response, because asthma response is just overreactive airways, where the airways start producing too much mucus and then having spasm. And so, especially if you're seeing your kid cough with exercise, with exertion, if you're seeing that, that is definitely something to bring to your doctor's attention, to have them evaluated for possibly having asthma type response. And because that we treat with inhalers.
Gotcha. Fantastic. So I feel like we're just going down a litany of things that our kids
Yeah.
have, but that's part of the fun. And the goal here is to help other parents, help other dads who are trying to figure out, gosh, my kid has these symptoms. Should I worry? How much should I worry? What should I do? What action should I take? So we'll just keep going. I mean, we're having fun, right? It's
Absolutely.
yeah.
Little tips head to toe.
There you go. That's right. That's right. So moving down a little, we've been seeing a lot of stomach bugs just going around. That's, I feel like, a common school uh, ailment. It's just germ
Yes.
spread. So can you talk about that and talk about that versus food poisoning? That I feel like can cause some challenges to figure out which is which. And yeah,
Right. So let me give everybody some relief. You don't really have to figure out which is which because we rarely treat food poisoning with antibiotics. It happens, but it's very rare. If you're seeing blood in the stool, then they definitely need to be evaluated. But the vast majority of the time, whether it's food poisoning or a stomach virus, it's a matter of just keeping them hydrated and be less worried about them eating right away and just keep them hydrated. It's best to use an oral rehydration solution, which is like Pedialyte. There is also Cure Hydration. Disclaimer, I am on their medical advisory board because I liked their product so much, but it is another powdered supplement that you can put in. I just think it tastes better than Pedialyte. One is not superior to the other, but those rehydrating with those helps you retain fluid because it has the right balance of salts and electrolytes in there, so they'll feel better faster. So the main thing is part of your home first aid kit should always be having some Pedialyte or oral rehydration solution powder, that you always have that on hand. And here's another tip. Don't give it to them with a straw. If someone is throwing up and they've been actively throwing up, using a straw introduces more air into the stomach and honestly can make you throw up again. So it's better to just sip from a cup. Whether they want it cold or room temperature doesn't really matter as much, but it's all about rehydrating. For food poisoning, it does tend to come on a little quick. It depends what type of food poisoning, but the fastest type of food poisoning can come on as quickly as 3 to 6 hours after a meal. And, if you've been at a Memorial Day picnic and you come back and 4 out of 5 family members, within an hour of each other are all starting to throw up, that's probably food poisoning. The good news is you'll be done in about 12 hours, most likely. But it starts with throwing up and ends with diarrhea. And again, the main thing is just rehydration.
awesome. No, that's really good to know, and knock on wood that we're not going down that road after all the summer holidays, etc., coming up. But
Oh yeah, 4th of July is a big one.
yeah, absolutely, absolutely. So you mentioned a home healthcare kit or home kind of emergency kit.
Yes.
That's brilliant. I didn't think about Pedialyte or its equivalent. What else would you recommend to have on hand in your house for something you have to go out and get?
Yes, I think every household should have their first aid kit. I my husband and I are both physicians, so we were definitely the rule in our neighborhood was if there's blood, call Dr. Jill. My husband's an anesthesiologist, so if they go to the hospital, call him. If they're outpatient, call me. But we have an exceptionally well stocked first aid kit. But I think every home should have one. So I start with pain relievers, pain and fever reducers and pain relievers. So you want Tylenol, which is acetaminophen, and ibuprofen, which is Advil or Motrin. They work differently. And in general, the go-to is going to be the ibuprofen. It's anti-inflammatory as well as lowering fevers. The Tylenol just lowers fevers and can help with pain, but does not decrease inflammation. So one of my neighbors says, she never can remember which is which. I'm just like, always Advil, A. And it can be any kind of ibuprofen. I'm not marketing for a particular brand, but it's just easier for people to remember. So those 2 pain relievers. I think you need a topical steroid cream like hydrocortisone. And that is going to be for itchy things. Do not get topical Benadryl. That's out. That does not help with itches, and I really don't know how it's still on the market. So just the topical steroid, which is like Cordaid or whatever hydrocortisone product. In terms of something a lot of us do wrong now is grabbing that triple antibiotic ointment. The truth is that there's about 10% of the population, give or take, that reacts to the neomycin component of that. And so you can actually end up with a itchy red area that's been made worse by the triple antibiotic ointment. What we know now is that most cuts and scrapes, what you want to do is, copious cleaning, ideally put under like running water under a faucet if it's your arm or a leg, just stick it in there, then really clean it out. And then you can pat it dry or whatever with a paper towel. But then just put a thin layer of Vaseline on it. So part of what belongs in your first aid kit is Vaseline, and we keep cuts covered and we keep them moist as they're healing. And that's a change from what most of us were taught when we were little. Please stay away from the peroxide and the alcohol. Those things actually damage the cells that are trying to do the healing. So Vaseline is the other topical product. I like to also keep some kind of menthol. So whether it's Vapor Rub or the patches, Salon Paws is a brand of menthol patches that I like. But any brand with there's like Icy Hot and Tiger Balm, they all make them. But I think those are nice to have because they can help with cough as well as achy muscles. And now as more and more of us spend all of our time in front of our computers, it's nice to have those patches for achy necks and backs. So that belongs in there. You want a decongestant, which is Sudafed. And now kids, again, we don't talk with your doctor before using any decongestants or antihistamines with your kids. But I usually say, one decongestant, which Sudafed is the name brand that most people know of. For the one that's effective, though, you actually have to talk to the pharmacist. It's over the counter in that you don't need a prescription, but it's behind the counter because it's controlled. And the one that's sitting out is phenylephrine, which is less effective. Just this past year, studies showed what doctors and patients have been saying for years, that new Sudafed doesn't work very well. And sure enough, it doesn't. So if you're going to have a decongestant, get that. Antihistamine of choice, Allegra, Claritin, Zyrtec. You want one of the non-sedating ones, whatever works best for your kid and your family. And really good Band-Aids. This is a pet peeve of mine. I love Disney. I have a daughter that's an animator that works for Disney. She doesn't work as an animator yet. She's a safari guide, but she works for Disney. But I love all the cutesy little Band-Aids, but you want the better quality ones because the cutesy ones tend to not stick well. So I always get the knuckle Band-Aids and the blister Band-Aids, and that's worth the money because your cut or blister is going to heal faster. So that's hitting the highlights. I actually have a list in my book for the best college health first aid kit. I'm cheating and looking here to see what I forgot. But those are the big ones for at home. I also keep some Tums in there, which is just, an antacid. And I'm not big on stopping diarrhea, by the way, since we were talking about the stomach bugs. We really don't want to slow down the gut when you're having what we think is an infectious diarrhea. So whether that's food poisoning or a stomach bug, I don't like using Imodium for that. To me, really, the only main reason to use something like Imodium to slow the gut is if you have a nervous gut and say you are a nervous flyer before you get on a flight, you might want to do that because you're going to have limited access to the bathroom. But that's the main purpose of those medicines.
Okay. Well, that's great to hear. That's really helpful. About
long answer there.
Well, no, I mean, that's what I wanted, is a comprehensive list of items. And I think this will be really helpful for people listening. So no, that's what we were looking for. You mentioned a couple of different ailments, that that can be solved, or that you want to have goods for, you want to have medicine for. One, you talked about cuts and scrapes, and that's another common sort of question that I get and that I've seen a lot around, which is like, when you have a cut, how do you know whether it requires stitches versus just let it heal kind of thing?
Right. So if it is deeper than a quarter of an inch cut down or longer than 3/4 of an inch, just across, and if it's gaping at all, I mean, usually if you have like a shallow scrape, cut, even from a knife, but if it's really shallow and it's straight and the edges are lining up, then usually you do not need stitches for that. But if you can see that it's gaping open at all, even a couple milliliters, you need to go have it evaluated. And please do not use home super glue. In college, architect majors are famous for this. So any dads out there listening that are architects, I see you. I know what you did. Please don't use that on your kid, because there's a difference between medical grade super glue and actual super glue over the counter. And the main thing is, though, you don't want to be sealing in infection in there. You want to be sure you flushed it out really well. And then if we need to align things, we can put on either the super glue, medical super glue, or throw in a couple stitches.
Awesome. Okay, that's good advice. Hopefully, dads, you heard that. No super gluing your own kids. And
Don't laugh; it happens.
no, I know it's the same thing with parenting, where you're like, why do I have to say this to you? Like, don't eat the foam, or don't, like you should know that. But yeah,
and the mom architects are just as bad. So I'm not picking on the dads. I want to be clear. I'm picking on architects, not on
perfect. Perfect. Another summertime question: bee stings, insect stings.
Yes.
What do you do when your kid gets stung? They're upset.
Okay.
Yeah.
So the general rule of thumb for all stings and bites is that you want to um, cool them down. So, and never put ice directly on the skin, but you can put ice in a washcloth or in a paper towel or whatever and hold it on there. The one thing, I live in Texas and we have bad fire ants. And for anyone who's in the South or Southeast, this is an important tip. If you accidentally step into a fire ant mound, which, by the way, tends to be right along the edge of bodies of water, and especially like when it's a drought and the levels are lower than usual, you think you're just walking along the edge of the water, and you don't see it. It just looks like mud, but you can step into a fire ant mound. What happens is they swarm on you, and they have some kind of, I can't remember exactly what it is, but they have some kind of chemical communication with each other. It's like 1, 2, 3, let's sting now. And so like you feel nothing, and then all of a sudden you look down and you're just getting stings everywhere. Do not shake your leg. If you shake it to get them off, it triggers them to sting more. So the best thing to do is just rapidly just kind of brush them off. So there's that. And then it is going to hurt. You can definitely take an antihistamine. There's no advantage to taking Benadryl unless you want to be sleepy from it. First, if you're at bedtime, the second generation antihistamines, so Allegra, Claritin, Zyrtec, all of those, again, generic is fine. You can definitely take a dose of that to help decrease your big histamine response. But the main thing is cooling the area. With scorpion stings, people talk about putting meat tenderizer on it, and there is that can neutralize some things. I'm pointing to my face because I actually got stung on the face by a scorpion a few years ago. I picked up a flag that had been on the ground, and I was tucked it under my chin to fold it, and that little guy just ran right up on my face and stung me. And I tell you what, those hurt. It's a neurotoxin, and it burns and stings like crazy. Mine hurt for over an hour, like badly. But basically, even that, they're not. And there are some poisonous scorpions in the Southwest. They're bark scorpions. If you live in Arizona, New Mexico, if you are stung by a scorpion there and you have any question about what kind, you that is an emergency and you should go to the hospital because they do require antivenom. But the rest of the country, most bees, hornets, all fire ant bites, it's mainly taken antihistamine and apply cold to the area. If there is a stinger, you want to just flick it off. Don't use tweezers to pull out a bee's stinger. Just use a credit card or fingernail and just scrape it to get that out. And keep in mind that anyone can have an anaphylactic reaction. If your kid or adult yourself, whatever around you, if somebody is suddenly feeling systemic problems, they are getting short of breath, or they feel their lips tingling, or they're turning bright red head to toe, you need to get them help right away. If somebody has an EpiPen, that's, you can call 911, but they may need epinephrine. So always be wary looking for those signs.
Perfect. No, that's great. That's very helpful to understand. And then you also mentioned in the home first aid kit a topical steroid. What is that for?
So actually, this is a time where you could use that. So for anything for stings, so bites or stings, you can definitely apply the topical steroid because that decreases inflammation. And we can also use it for basically if something's red and itchy, it's okay to start with that. If something is getting worse after using a topical steroid for a couple of days, you may be dealing with a fungal infection. And in that case, it's going to get worse and not better, and you need to stop the steroid and go in and be seen. But in general, red and itchy, topical steroid.
Perfect. Okay. Thank you. I want to go back to the stomach area.
All right.
The appendicitis. That's another one where, your kid
Yes.
says, "Oh, my stomach hurts." How do we know what should we look for? A normal stomach ache for something that needs to, have action taken.
Right. So appendicitis tends to be sort of a smoldering kind of thing, and it's not usually kids playing and happy, and suddenly, oh, my right lower quadrant, which is where the appendix lives, bottom right corner of your abdomen. It's not typically something where they suddenly have pain there. If you suddenly have pain there, it's honestly probably more likely going to be a gas pocket. But appendicitis starts off as just a general ache in sort of the whole belly. If you ask kids where it hurts, they point, it's the whole belly, not one area. And they may have some nausea. But very importantly, a good clue is if they are still hungry, if they're complaining of stomach pain, but they're hungry and they want to know what's for dinner and they want a snack, it's much, much less likely to be appendicitis. If they have no appetite at all, that's when my radar goes up and I'm like, we need to look at this closer. So starts off as generalized achy pain. They may or may not have fever. If they get fever, it may come a little bit later on in the course of that belly pain. And then the pain can shift from being generalized or near the belly button down. If it moves then down to the right lower quadrant, that's where we really start getting concerned about appendicitis.
Excellent. And what steps should parents take if we suspect appendicitis? What do we do next?
If it is a weekday and your primary care physician is accessible, I would start with calling them because, this is definitely a hands-on diagnosis. We in emergency rooms rely on CAT scans, but the first step is still examining, and there's some physical signs that we can tell. So I would let the doctor put their hands on your kid's belly, and then they can facilitate transfer to a hospital. But it sort of depends on your setup with your doctor. The other option would be I probably would not go to an urgent care. I would either go to my primary care physician or an emergency room. Because in urgent care, they're almost always going to order the scan. And so that's a little bias from being a family practice physician. That may be unfair, but you could start either way. If it's the middle of the night, go straight to the emergency room.
Yeah, better safe.
Also, if your kid's hurting enough to be up in the middle of the night, that's another concern.
Right. That's a sign. Uh, Moving down, talking about more just sports injuries, like
Sure.
your child twists their ankle, they're running, they're in a lot of pain. What do you do, and do you recommend an X-ray? How do we know whether we should be taking an X-ray or just having them rest
Right.
for a day or two, kind of
So
thing?
it's interesting with x-rays. We over x-ray ankles and we under x-ray wrists. And part of that's from people not coming in. So let's talk about wrist first. We'll do top and then bottom. So if a kid, we call it foosh, Foosh. If you have a fall on an outstretched hand, so foosh, and that happens when you fall off a bike, when you're roller skating, when you're running, and fall on an outstretched hand. That is when we can get a wrist fracture. And a fracture just means, a crack. It doesn't have to mean, definitely, an open fracture is, heaven forbid, a bone sticking out. And thankfully, we rarely see that, or infrequently. But the bones may not be displaced at all, but they might just be cracked. And with a wrist, a lot of parents will say, oh, if they can move their fingers, it's not broken. In fact, I have a kind of funny story on myself. Our older daughter, her ninth grade birthday party was a roller skating party, which I kind of pushed her into because I wanted to be sure we could invite everybody and include everybody. And we were joking as the parents dropped their kids off. We're like, oh yeah, don't worry if there's any broken bones, we'll take care of it. We'll take them to the ER. Yeah, my girl on her birthday fell on an outstretched hand. Definitely could move her fingers. The manager that worked there told her, oh, that's okay. You can move it. It's not broken. It was broken. So take the wrists in. On the ankles, if you cannot bear weight and take 3 to 4 steps immediately after the injury, or if you can then, but you wake up the next morning and now you can no longer bear weight enough to walk 3 or 4 steps, you need an x-ray. There's a few other things that we look for pressing in different spots, but the biggest thing we see is kids who, they're walking fine on it. They're bearing weight. It might be a little swollen, but like we don't see any bruising or anything. If it's more a nuisance, I would tend to give it ibuprofen and give it a few days. So you want that anti-inflammatory in there, and you can use an ACE wrap, which by the way, I do also keep in the first aid kit.
Mm.
I didn't mention that, a compression wrap, and just to keep the swelling down. But the key thing is if you cannot bear weight on it to do at least 3 or 4 steps, you do need to bring them in for an x-ray.
Okay, that's interesting. And so the reason that we under x-ray, you were saying wrists, is because of that example you gave where
Yeah.
it's like,
People are like, oh, well, it must not be broken. And they don't look bad. Honestly, broken wrists don't swell that much. They're just not that impressive to look at. They hurt, and they hurt impressively, but often, I can't tell you how many physician parents I know who have had a kid who had a wrist fracture for several days before it was diagnosed because everyone kind of blew it off, and they knew the kid was hurting, but they look at it and they're like, "Oh, there's no bruising, there's nothing obvious." But then a few days later, get an X-ray.
yep.
The good
Okay.
news is that kids' bones, we joke that they can be in, the ends of kids' bones can be in the same room and they're going to come back together and heal. So the good news is that these things heal really well. We usually just have to splint them. But you need to know. I mean, because obviously you want to limit activity that could potentially worsen a fracture. So that's a reason as much as any.
Yeah. Okay. That makes a lot of sense. Thank you. That's, unexpected. I didn't realize that. So
Yeah.
good to know. And hopefully not something that I need to act on, or we need to act on as
I
our
hope
listeners. Yeah. Yeah. Let's talk about sleep for a minute, if that's okay.
Yes.
And, that's obviously a big issue, a big challenge. There's sleep issues that young kids have. Can you talk about maybe some of those common issues and how we can address them as parents, as dads?
Yes. So here's the hard part. We have to role model it. And being what everyone thinks, technology. It was so before the phones, it was easy to just say no televisions in your bedroom. And we knew that screens, messed up your quality of sleep. But the problem is that so many kids, especially with the gaming or social media, they're designed to have no endpoint. So at least with games, if you get to a level, a lot of kids can say, "Okay, I will stop when I reach this level." But with the social media, they just start feeding you more and more of the same fun videos that you like to watch, and it is such a time suck, and you don't have any idea how much time has gone by. So one thing with sleep is having the phones outside of the bedroom, and that's a lot of people have a very hard time with that. These electronic pacifiers are pretty powerful, and I'm guilty as well. And I have to make myself put it where I can't reach it or can't see it because it's so easy to grab. But kids really need more sleep than they're getting. They need 8 to 10 hours, adolescents, and some need 12. And obviously, if they got to be up for their sports team or dance or whatever they've got practice before school at 7, trying to get them to go to bed at 9 is tough. And in most cases, kids don't, and they're not getting enough rest. And it's, it's not good for your mental health or your physical health. So the other things are to start establishing, like we did when they were little, of having a bedtime routine. It's really good to teach that sleep hygiene to kind of reteach it to our teens of what do you do to unwind. There's a reason we give babies baths. So take a shower before bed, which is a good idea for adolescents anyway for acne. And they don't have to wash their hair every time, but just showering off, having good smells that relax you. You take a bath if they enjoy that. Some kids do, some kids don't. But have that winding down, and then a time to either just listen to music or actually read a book can really help put you in a more relaxed state. And if you want to listen to sleep stories, do you know what sleep stories are? So rather than guided meditation, a lot of kids and adults prefer sleep stories. And it's this sort of monotone storytelling that for a lot of people just puts them right out. But then, then you're left with, then you have the phone right there and it's there when you wake up. So that's a temptation you got to figure out. But the biggest thing is to prioritize sleep and talk with your kids about, do they feel rested? If they're tired every morning, you don't want to be hounding them about that on their way, breakfast before school. But in the summer, when they can get more sleep, talk with them about how they feel and setting limits on the phone stuff. You can do right on your iPhone if they have an iPhone, which we're generally encouraging kids to hold off on smartphones till 8th-ish grade. It's very kid dependent, but you can set limits. You can go in the settings and set limits, just like on Instagram, that you can only be on there for 10 minutes a day or whatever, and it alerts you. And I use that because I do posting and stuff for work, but it sucks me in there too, and I'll be in there too long. So I think that's a big part of what we can do to help with their sleep.
Yeah, no, that's great. And I like how it dovetailed so nicely to what we can do for our sleep as parents. It's just a lot of similarities that's one of the biggest challenges of parenting is the role modeling, right? Where your kids don't do what you say, they do what you do.
Yes.
That's how they learn, right? So
very true, and very true for things like drinking. And the younger generations are actually much better about not drinking and driving. They would call an Uber. They wouldn't even consider driving after having, and I'm talking about kids that are legal here, but we need to really pay attention, because what we do to role model as our kids are young, that is what they're learning, way more than what we say. It's what we do.
Interesting. So on the alcohol example, with parents who have younger kids, we have we have neighbors over, and we'll make drinks and things like that. So that's, it is what it is, but all in all, probably a negative modeling. I mean, your kid's going to see that and say, "Oh, that's
an opportunity." I just look at it as an opportunity to, if it's neighbors and they've walked over, then they're not drinking and driving, and hopefully they're drinking responsibly. But if it is somebody who's driven from somewhere else, it's a great chance. Or if, say, you're visiting someone else, just say, "Oh, I'm driving tonight, so I'm stopping at 1." And just it's amazing how that message will come through.
That's a great type of modeling. That's and part of that's also a big important part of modeling is being able to say what is happening, right? Explaining it to your child, not just
Yes,
so they can see what you're doing, and then you can say why you're doing it, and make sure they catch on to that.
exactly.
Yeah,
Totally agree.
yeah. One last topic I want to hit before I let you go here, Jill, is biting nails, nail biting. Just something that a lot of kids do. And so I'm curious kind of what causes it, how concerned we should be, and things along those lines, and what strategies we should take to try and curtail it.
All right. It's a tough one. And it's about 30% of adolescents. And we see this a lot in college health. And it becomes a problem because part of, as you're interviewing for jobs and stuff, and people are looking at your hands, and it's part of hygiene, and it's part of the image that you're projecting. And so it tends to run in families. And it can be sort of picking at scabs or picking at acne is a similar tactile habit. And the good news is that cognitive behavioral therapy, which is not, lay on a couch and tell me about your mother. It's short, directed therapy that gives you specific tools to address a specific problem, actually has a very high success rate of helping with nail biting. And they give you strategies, like, for example, they may give you they may help you recognize every time as your hand is coming up to your mouth, to bite that nail, that instead you stop and you do these finger exercises for 30 seconds. And but there's distraction techniques. You can wear like the rubber wristbands that we used to see a lot more of, that's to support cause, but you can pull on those, and that gives you some of that same something to do with your hands. You can use a spinner fidget that can help. With nails specifically, there are some different products that some work better than other. I don't have a favorite to recommend right now off the top of my head. There's one that starts with an M, but I can't think of the name of it. But you basically paint it on like nail polish, and it just tastes really bad, really super bitter. So it's a immediate one. It's just calls your attention because a lot of it's mindless. People, it's just like a anxiety behavior. And so it calls their attention to it. And then for girls more than guys, although some guys enjoy painted nails, but there's a product called Dip that is not a fake nail being put on your nail, but it is a powder that they basically layer on, they paint on what looks like nail polish, then they dip that in this powder, but it ends up making your nail super strong and you can't bite it. So that's a little pricey. It's about $40 a thing, and you have to repeat it about once a month, but it can be really good to help people break that habit.
Awesome. No, that's really helpful. That's really helpful. And Jill, this whole conversation, frankly, has been just very dense in a very good way. Like, we just flew through topics and hit a number of topics. Is there any other advice or tips you'd like to give us dads who are listening? Or did we cover pretty much everything here?
Actually, I want to say one thing quickly about ear piercing,
Hmm.
because there's a lot of piercing, and that's both genders, but particularly with the ears. The one thing you need to know about that is that any ear piercing on the lobe of the ear, those get infected about 20% of the time, so 1 in 5. So it's pretty often. But those are pretty benign, and we can treat those just by cleaning with sterile saline. Again, no peroxide, no alcohol, just sterile saline, and you just wipe it multiple times a day. And honestly, those generally clear right up. But if someone has a cartilage piercing, so the upper part of their ear, which are very, very popular, those get infected about 30% of the time, and those do require oral antibiotics. So if your kid has a piercing infection and it's on the nose or the cartilage on the ear, those need to be seen. So,
Okay. No, that's good to know.
yeah,
That is good to know. And I didn't realize the infection rates were that high either. That's
yeah,
surprising.
it's really common.
Yeah. Yeah. Hmm. Okay. Well, Jill, this has
Another
been,
tip.
what's that?
Just another, fun little medical tip. But
Yeah, no, that's that's awesome. And again, Jill's book, The Ultimate College Student Health Handbook, has a ton of things like this, and it's just very readable. It's short little question answer. I don't think it's just for college students at all. So I would really recommend it. And Jill's website also has a lot of information, jillgrimesmd.com. So and like we said, the college doc at TikTok, this will all be in the show notes as well. But Jill, thank you so much for joining us today.
thanks for having me. I wish all the dads all the best.
Thank you very much.